In 2 weeks, I was back to work. Well, actually, I was back on my bike after 4 weeks.
And after his second hip replacement, Paul Bowers was back home the same day.
It was just amazing that the next day, I know it sounds kind of funny, but the next day my hip actually felt better than it did the day before, minus the post-op pain. So it was an immediate relief.
Paul suffers from arthritis. Add that to his running, biking, and bowling, and he was in need of some relief, but had worries because he was only in his early 50s.
It was nice to hear him that he treats the pain, not the age. So it was nice to hear that, because it was getting to the point where I really couldn't do a lot after work. I was pretty much, I would get home and pretty much just sit because it hurt so much.
Orthopedic surgeon Todd Galdis used a traditional hip replacement on both hips in 2 separate surgeries, but it was the procedure that made this easier for Bowers. He accesses the hip through the front instead of the side.
The idea being we're minimizing damage to muscles on our way into and out of the hip to allow for a speedier recovery, a less painful recovery, and hopefully a more reproducible hip replacement that's going to last long in every patient.
And this special table makes that surgery easier for the doctors.
It allows for easier patient positioning during surgery. It has some attachments to it that help me during surgery to gain access to the hip in a way that essentially eliminates needing another assistant.
About 40% of surgeons across the country are using this kind of procedure today. Dr. Galdis says just about everyone who needs a replacement is a candidate, and he loves seeing the results.
It makes my job rewarding. Putting in hip and knee replacements in people who want to be active and have been active but all of a sudden are limited because of pain, when you see them come back just 4 weeks after surgery and they say, I wish I had done this sooner, I'm already feeling better.
That's where Paul is now, back to biking and bowling pain-free.
I used to be, I would worry about, if I do this, what do I have to do for the next 3 days? Is it something that I can kind of take it easy, and now I don't even have to think about that. I am so grateful for him. Without him, I would still be walking around in pain.
For MedWatch, I'm Michelle Dunaway.